When it comes to the greater occipital nerve, this is what we need to do. We need to, okay, here we go. So we've got the occiput in C1, C2, and you've got the spinous process of C2, and so what we want to find is we want to find the inferior oblique muscle that goes from the spinous process of C2 to the transverse process of C1. When we see that muscle, then the greater occipital nerve is going to come out. Okay, and then we can go long on it and see it go and it gets entrapped over the nuchal line. So we can block it here, but we need to treat it at the nuchal line because that's where it gets pinched. But we need to at least find it and see it here. So then we can eventually.
Sì, voglio dire che il nervo lo vediamo lì, ma poi lo trattiamo qua perché qui viene pinzato, diciamo. La linea nucale.
Okay. So the third occipital comes off the facet, and it goes, and that's the third occipital nerve.
Terzo nervo occipitale.
And then the lesser occipital nerve comes out, and it goes.
Piccolo nervo occipitale.
Okay. So that's your lesser occipital, greater occipital, and then this is actually third occipital. Okay, but
nervi, diciamo, che ci interessano.
But the main thing we want to do is do this. So we're going to progress up the vertebra. These are facet joints, spinous process, and we're gonna see lots of muscles, and then all of a sudden one big black muscle, just like the piriformis. We want to find the one big muscle, and when we do, then we'll see the greater occipital nerve right over the top of it. So it's a really good landmark. So that's going to be the first thing that we're going to do.
Per trovare l'occipitale bisogna trovare questo muscolo, che è un muscolo molto ipoecogeno, che si vede salendo fino a che si trova questo muscolo.
Yeah, so it's complex, one big muscle. Okay. So then we're going to do the facets. So if you
Facette articolari.
So with the facet joints, you'll on him there'll be not too much arthritis.
Non c'è molta artrosi in questo nostro paziente.
With our patients, they have spurs. Okay.
Forse è l'osteofita, insomma.
Osteophytes. And now the medial. So we'll see that, and then we'll see the medial branch.
Le branche mediali.
The medial branch is sitting here.
Quindi c'è un nervo lì dietro?
Yeah.
Allora, sul contorno della osseo, la branca mediale sta nella parte declive. Questa qui. Ci sono le branche mediali, cioè l'equivalente delle branche mediali ombali.
As they go, from up to the joint, top to bottom. So we're gonna see that pillar there.
I pilastri, dai pilastri.
Okay, so that's going to be the two things, and the main thing with the greater occipital is going up, and then if we go from 2 to 1, 2 to 1, and when we go from 2 to 1, see the greater occipital nerve right over the top. Now when we do the facets, we go straight lateral, and then we see the roof. Okay, so and that's the main thing is the orientation of the probe. So just like this, okay, and then we try and find it. And now sometimes you have to realize, it's a little curved because our neck is curved, so it might be.
certo, Franco.
right? So it's a little the lordosis, the curve.
Sì, sì, sì.
Okay. Okay. Alrighty, I need the
I don't know.
To something.
I don't know.
oh,
Telephone from that one.
okay. All right. Well, let's keep going. You're fine. Let's keep going. Okay. So let me have a little less depth. Less depth.
Riduce la profondità.
Okay. All right. So we have this. So we have the spinous process and facet. Spinous process, facet. You see the deep cervical artery? Okay. The deep cervical artery comes out between 7 and 1, between C7 and T1. So that's, and this is the facet. See the double line? That's facet. But that's spinal cord pulsing right there. So what I'm going to do is I'm going to go up. So this is all complex. I'm going to go up, and you're going to see one big muscle. And now, one big muscle. Go back. There. So you see, now I'm going to go up. So complex, 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 one big muscle. Greater occipital nerve. Every time. Right there. And now, so this is from 2 to 1. So what I'll do is I'm going to go long axis, and there's the greater occipital nerve and long axis. It's pretty big. It's a very big nerve.
The third?
No,
No, the
greater.
greater.
Questo è grande occipitale.
Yeah.
This is
Nervo
great.
grande occipitale.
Yeah.
Occipitale.
So when I go like this, we see the inferior oblique muscle and the greater occipital nerve in short axis. So look, so I've got the probe going from. I have the probe going from 2 to 1, right? With the nerve coming out this way. Uh-oh. No more ultrasound. No. So now you have to look at this only, okay? You got to visualize. But, so it's from 2 to 1 with nerve going over the top. But now if I want to go long to the nerve, I'm going to go long to the nerve instead of short, long to the nerve. Now I'm short to the muscle of the inferior oblique. I'm also short axis to the rectus capitis posterior major, another muscle. So in other words, you have your inferior oblique and your rectus capitis posterior major, rectus capitis posterior minor. So there's so we have so inferior oblique, and then we have rectus capitis posterior major, rectus capitis posterior minor. So when we go this way, we have two muscles when we're going long to the nerve. Understand?
Cioè quando lui gira la sonda e si mette per innanzi lungo col nervo, sotto
Okay.
hai due muscoli che poi in asse corto. Quindi vediamo.
Okay, so there's the nerve and one muscle. I'm going to go long to the nerve, and now there's two muscles, inferior oblique, rectus capitis posterior major. And then if I follow that nerve up, I can follow it up. If you look, I'm going up over his occiput. So that's the greater occipital nerve. So that's the first thing we're going to do, is just to find it. Eventually you'll learn how to treat it, but you have to find it first. So there it is right there. And then you can try and go long on it, because then you can go over to the C2 here. So that's our greater occipital nerve, right? And short axis, muscle from 2 to 1, or long axis over the two muscles here. Okay, so we've got that. That's good. No, hold that. No, it was one.
No, questi sono.
So,
Sì, sì.
he doesn't like his machine looking bad. There you go. Now we'll find out. Okay, so can we ask him to lay on his side facing me?
Puoi girarti
Fianco, sempre lui.
di fianco, per favore.
No, facing me.
Dall'altra parte.
If that helps a little, sorry. Now, okay, so why do I have him like this? I have him like this because I'm going to show you the greater occipital nerve and how I would approach it, but also this is how I would approach the facet and medial branch. I want to come in from the front to go toward the back, because if I go from the back toward the front, I go toward the spinal cord, I go toward the vertebral artery, I go through the carotid. So if I start in the front, if I miss the into the muscles. So it's much safer to miss into the muscles than it is to miss into the vascular. So what I'll do now is I'll so there's the complex. So here's spinous process, and then this is these are all those. This is that deep cervical artery, and now I'm going to go up, big muscle, greater occipital nerve. Okay, so this is the same. So then if I went long, there's the nerve in long. You can see the good approach now. To block, if I wanted to block it, I could go right in plane.
Cioè se vuoi fare la
Ok.
procedura sul nervo in asse
So with
lungo,
them on their side makes it
Lo
easy.
prendi dal davanti alle dietro, così
esatto,
non
vai
hai
in senso
interferenze
antero-posteriore, così non hai, se ti
interferenze
sbagli
di
non vai...
altre
Ok.
strutture anatomiche.
All
Sì,
right.
chiaro.
So now the next thing is we're going to do the facets. So there's his facets. Facet, facet, facet. And this medial branch, medial branch, medial branch. And now another facet. And now on the C2, C3 facet is your third occipital nerve.
Quella è là.
Il terzo nervo occipitale.
So it's the third occipital nerve. So that's the third occipital nerve. Then you'll have your medial branch, and medial branch, and medial branch. And then those are your facet joints. Okay? And then you have medial branch there. So straight lateral. So you can come in with a 30 gauge 1-inch needle and do medial branches and facets and not get in trouble. Because if you look at the depth.
C'è un ago piccolo di 30, piccolissimo.
Quindi un 30 gauge.
Sì.
Because it's only 15 millimeters or less. It's very shallow
È molto
on
superficiale.
everybody. So you can use just a very small needle and get your facets and your medial branches very easily. Okay?
But when you have to needle the facetal interarticular,
Yes.
you use a lateral approach
I just come in right like there.
from these
Yes. Short axis.
to the axis,
Yeah. Right.
not
Right.
from posterior.
No,
from
because
the-
I want to go anterior because I want to, if I miss, I go into the muscle. If I go from posterior, vertebral artery. I don't want to go toward,
posteriormente c'è un'arteria, ho capito bene?
No, posteriormente c'è muscolo, anteriormente invece c'è arteria vertebrale, nervi.
Allora perché non va posteriormente?
Va posteriormente. Lui va dal davanti, cioè lui va dall'anteriore al posteriore. Cioè,
Per l'interfacettale.
anche per le faccette. Diciamo che è molto sottile.
and,
però usa-
and by the way, I can show you something else for now. This is vertebral artery,
Questa è arteria vertebrale.
Sì, chiaro.
and then
chiaro.
there's nerve roots.
Sì, certo.
So there's a nerve root.
Sì,
There's
sì.
a nerve root. So we can do cervical nerve roots as well. But this is why. But I'm going to go posterior. with my probe. Facets.
Sì.
See why I don't want to go that way? Because this is vertebral artery. So,
Cioè davanti c'è
vertebral
la
artery.
vertebrale, subito dopo sono le
So
faccette.
look at the probe. Look at the probe.
Sì?
So this is vertebral artery.
Sì.
Now look at the probe.
Sì.
Facet. Vertebral artery.
Sì.
Facet. Vertebral artery. I don't want to go this way. Okay? So all right, so let's go scan. Go. Let's split up.
Roof.
Keep
Root.
going back.
Okay. Back,
Posterior,
back, posterior.
posterior, keep going, and facets,
Facets.
medial branches,
Medial branches is
right there, facet,
sì.
medial branch, facet,
Ok. Quindi so with the angulation is this. Sì.
straight,
Sì.
straight down.
Capito.
Okay? Facet, medial branch.
And you can needle the facet with
And you can see how, yeah, you can see
So?
how, yeah,
so
yeah,
così.
yeah,
But
Out of plane.
yeah. And then you can go in plane there, there's facet.
ecco, questa è la
You could
faccetta.
go long axis this way.
And the other, this is facet
Yeah.
with posterior approach.
So, yeah.
So I can go and where is the middle branch?
Medial branches are lateral.
Qui? Ancora più avanti? Ah, eccola qui. Sì, sì, sì. Ok. Ok.
So now, no, here, one more thing. Hold, no, wait, come back. Muscle, 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 and up. Big
Ah,
muscle.
sì, sì, big muscle and
great
great-occipital nerve.
occipital.
Great-occipital nerve? Sì. Ah, eccolo, che così. Long.
Long.
Long. And
Short.
so short. Long. Okay. It's round the muscle.
Big,
Round the muscle.
yeah, you can see, and you can come in and get it there.
Round the muscle.
Yeah,
But
but I want to go up
What-
to the nuchal line too and get it where it pinches up high too, but, yeah.
what pain you treat with this?
Vertigo occipital.
Greater occipital headaches,
Hemicranic?
headaches, migraines, headaches. This is this is third, this is greater, and this is least, and this is auricular, and this is hypoglossal. Those are headaches.
The third is here.
Third is right in the middle.
No.
The middle.
And greater's here, lesser here, auricular there. Yep,
Okay, I thought.
yeah. Vertebral artery. Facets.
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 Third occipital.
Ah, terrosi.
Yeah. Facet. Medial branch.
Middle branch.
Facet.
Middle branch is the black spot.
Yep. And there's black round things. Okay, and then let's do this.
Ah.
Muscle, 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 big muscle,
Big
greater
muscle.
occipital nerve.
Ah, okay.
long axis.
Long axis.
Adesso lui si sposta di là a far vedere questi.
Oh,
Short axis.
short axis. And it's left.
Yeah. Over and over and over. I've only been doing this,
I look
20,
for volontary.
25 years.
25 years.
Yeah.
Okay.
That's all. No problem.
I have.
You have 24 to go.
I look for voluntary. Young woman.
Gli altri sono composti dal semimembranoso semitelloso e forse dal
Media branches.
sono
Media branches. Vertebral artery. Facets. Yeah. 1 centimeter. No big deal.
no, sono del
Muscle. Oh, big. See, going from 2 to 1, or the rectus capus posterior major, inferior oblique, coming out of 2. Okay. There you go.
Thyroid?
Yeah, thyroid. Yeah. Oh yeah, we do a biopsy on thyroid. No problem. Facets. Vertebral artery.
Yeah.
Facet. Media branch. Facet.
Where do you start usually to find the facet? From
Right in the middle. They're flat.
vertebral artery?
Vertebral malleable posterior. There. Facet. Okay. We're gonna go like this.
Okay.
Muscles.
Yeah.
Muscles. Big muscle.
Yeah.
Great
Okay.
occipital nerve.
I rotate. Just
Going big muscle. But now the thing is remember you're going from two to 1. There's the nerve.
okay.
Then you can go long.
Okay. Just like this. And then
Yeah, it's like, yeah. Next time, huh?
I have to perfect.
Yeah, definitely. Says vertebral artery. Nerve roots. Says. There. More interior. Media branch. Wait, we're gonna go. Third occipital. Right there. Now let's go this way. Go 90. Deep cervical artery. Muscles, 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 muscles. Up, third occipital. Let's see, from 2 to 1. Nerve and short axis, 2 to 1. And then we go 1. Now we're from 2 to 1 and long axis. There. Rectus caps posterior major, inferior
Last
oblique.
one is
This is
the
2.
passage to the occipital.
Yeah, this is greater occipital. Third, the lesser occipital is going to go up and through, and third occipital is going right there. Third is just going to go up to the midline. Time to go? Yeah. Yeah. On the board. Yeah, the board. Take the board, and then you come get the machine next. Let's go. Okay. Who else? Come on, come on, come on. Come on. No learning with talking. Set. Vertebral artery. Vertebral artery. Facet. Vertebral artery. Facet. Medial branch. Medial branch. Third occipital. Right there. Now let's go this way. Turn 90. So now we're going to go up. We're going to see muscle, deep cervical artery. Watch muscles. Oh, big muscle. Greater occipital nerve. From two to 1.
Ok.
And now we're going to. Now you're 2 to 1 the other way.
Yes.
Then you can go inferior, the rectus caps posterior major, inferior oblique. Anybody else? Everybody's done? Okay. Yes.
What syndrome will you treat with infection of the pudendal zone?
Plastico di questa. Allora, come pungi? Posso un attimo? No, devo passare di qua. Devi mettere seduto e
Qui sempre seduto, per lavorare.
perché vedi, se no devi tirare sul letto.
Sì, perché sennò non ci vedi bene,
però
è un
sei in
altro
uno
mio
studio
problema.
e
Sì.
fai questo, diciamo. Allora ti trovi l'immagine e da davanti all'indietro vai in asse corto, cioè in out of plane. Così. Vai prima sotto la sonda, quindi sei molto superficiale, torni indietro, ti approfondisci fino ad arrivare, cioè vedi l'ago qui, ago qua.
Perché poi queste altre strutture tanto non le vedi, cioè non c'è nessun pericolo.
No, non c'è nessun pericolo, ci sono solo muscoli, quindi niente. Lui diceva di non fare il contrario,
Perché invece
perché se tu fai il contrario e non controlli,
Ti infili dove devi.
ti infili,
Lunedì va via martedì.
ti
ti faccio
infili
indicare il vaso come abbiamo visto
vasi
prima.
vertebrali, ma comunque se tu usi questa è la vertebrale, se tu usi un ago da 2 cm e mezzo non puoi fare nessun danno comunque.
Guardando di qua, superficiale.
Qui superficiale dietro
Sì, direttamente,
ci sono solo muscoli, quindi non hai il concetto è questo. Ecco, l'interessante è contare anche le... vedi, questa è la 2-3, la prima,
E come fai invece? Perché
vedi poi finiscono, non ce ne sono
ok.
più. Vedi? C'è il pilastro, il primo pilastro è questo qui. Cranialmente non c'è più nulla, c'è il cranio qui adesso.
ok, quindi
E qui bisogna stare attenti perché qua dentro c'è il midollo, arteria
Midollo,
vertebrale,
arteria, la roba buona,
no,
cioè.
qui non ci si deve andare. Metti un po' il colore un
Da lì esce
attimo.
la vertebrale dentro
Metti il colore. Abbassiamo il box.
Action.
No.
beh comunque da
Ma perché non... Dov'è
Dove è
il
andato?
Oh, forse
rappresentante?
bisogna già.
Vabbè, fate voi, dai. Comunque, lì ci sono i vasi vertebrali.
Eh sì.
C'è il sifone vertebrale. Fai una cosa, ritorniamo su
Dove
doppio,
esce
dai.
dalla colonna e
Esatto. Dai, fate voi.
passaggio V3,
Fate voi.
V4.
allora posizione
Ma no, ma avete parlato prima che eravamo tutti.
Sì, muovi in senso laterale, prima o poi incontri i pilastri. Poi è una questione di inclinazione. Eccoci, ci sei. Ci sei. Ottimizza un po' l'immagine. Ottimizza l'immagine.
Senti, io di qua, però così che ti chiedo una cosa che non c'entra con... È sempre molto sgranato. Che cos'è?
Ora non è settato bene, ma spesso alcune cose sono scarsi. Comunque anche questo, per lui per esempio era più sgranato, adesso l'ha reso più morbido. Vai, cerca la faccetta, fai vedere lo spacchetto, guarda, c'è una branca,